Hello Patricia, my name's Nick. I am a paramedic from the Queensland Ambulance Service. I'm not sure if you remember me or not, but I was with you at the scene of the accident. If you have any questions, I'm happy to answer them. So at the scene of the accident, we found you to be quite distressed, but your GCS was very good at 14, which is a positive. How are you feeling after the helicopter ride?
I'm doing okay. What does GCS mean?
GCS stands for Glasgow Coma Scale and is a measure of your consciousness. So you were wide awake, which meant you probably didn't have any serious head or internal injuries. There is a bit of a bump on the left side of your head, which we want to have a closer look at. And the pain that you're experiencing on the back of your neck is most likely due to whiplash from the accident. We suspect your hips may also be fractured as well as your left forearm. Your husband William's okay. He's a little bit shaken up, but he'll be in here to see you very soon. I'm now going to hand you over to our lovely nurse Heidi, who I can assure you will do as much as she can along with the pharmacist to ease your pain that you're experiencing. She's also going to get you some CT scans so we can make sure that we haven't missed anything.
Hi, Mrs. Jones. I would like to check, is it alright if I call you back?
Please call me Pat.
Okay. Hi, Pat. I'm the nurse from the hospital. I will be looking after you. Now I can see her bruising to your chest, right arm and right leg. Also, your scans have come back to show you have fractured your hips and left forearm. However, the x-rays of your spine, chest and pelvis have fortunately come back indicating no problems. Most of the cost is covered by Medicare and your health insurance. Don't worry, Pat. And also you'll be able to walk, though you may experience some reduced mobility due to the incidents. If you're worried about how you will able to manage things at home, there are support services such as hospice that can aid. Sadly, we have found a secondary brain metastasis possibly caused by your previous primary breast cancer. But let me assure you, we will provide you the best care possible and immediately consult a radiation therapist for you. Is there anything else that you need to know?
The hospice care sounds good, but cancer? Again? In my brain? Is the rest of my family okay?
We are also sorry to let you know that your grandson Sully has passed away. I would like to let you know that I'm here if you need, or we can get you a social worker to talk to you. And I assure you that your family will be close by throughout your care.
Thank you. I feel comfortable in your care.
Okay, we have Pat Jones, 68 years old. This is the report from the paramedics.
Thanks, Heidi. Was she complaining of any pain due to her injuries?
Yes, she complained of a severe pain in her left arm and pelvis.
Okay. Well, since Pat has a history of reactions to paracetamol, the doctor and I have decided to give her morphine to ease her pain. If there are any abnormalities or if she has any further complaints, let me know and I'll reassess her treatment. Also, Pat was taking omeprazole for her reflux, but we've decided to cease these dosages whilst her fractures heal and replace them with antiemetics to prevent any further fractures.
Okay, thanks Liam, I will keep you updated. Okay, Andrew, from the CT scan we found a malignancy in her brain.
Has she had a history of previous cancers?
Yes, she has a breast cancer in the past.
It's probable that the breast cancer resurfaced and the mammogram wasn't able to see it through the scar tissue of her first surgery. And that cancer caused the secondary metastasis in her brain. In consideration with the overall deteriorating condition, the oncologist has prescribed her a palliative care dosage, which is about 20 grays and 5 fractions in a week. This will make the mask when she comes for her first session of treatment. Liam, what will need to happen in regard to medication while she's going through radiotherapy?
Well, Pat was on Herceptin to treat her initial breast cancer and tamoxifen for her hormonal treatment, but now that we're focusing on palliative care and in the tumour in her brain, we're ceasing these prescriptions. Also, the tumour may cause some significant swelling in her brain and the radiation and chemo may result in nausea and vomiting. So to treat this, Pat will need to be given dexamethasone.
Okay, thank you, Liam. I'll brief Pat on our treatment plan. Hello, Pat. My name's Andrew. I'll be one of the radiation therapists working with you over the course of your treatment. If you have any questions or issues, please don't hesitate to ask. The treatment will start after a couple of days after you've discharged. The first session will make a tight-fitting mask to direct the machine over the entire course of the treatment. After this, the mask will be lined with dots to direct the exact places we want the machine to go, and then the treatment can begin. The treatment will require you to lie still for about 10 minutes each session, while the Linac, the giant machine, will be removing around your head. It doesn't get very close to your face, so it isn't very claustrophobic. The treatment plan we have chosen by the oncologist is 20 grays and 5 fractions per week. Grays is the amount of radiation dosage, and fractions just means the amount of sessions per week. This treatment course is low on the absorbed radiation, so you shouldn't feel any side effects except for some fatigue and perhaps some nausea. This will be managed by the medications a pharmacist has prescribed.
5 times a week? I can't get into hospital 5 times a week. How am I going to get there?
Don't worry, there are some support systems in place for you. If they're unable to be brought to the hospital by your family, you can book a transport appointment with the Queensland Ambulance Service. You can call them up to 24 hours in advance and tell them your info, and you'll be able to, then you'll be fine. They'll come. The numbers are 131233, I believe.
Alright, thank you, Andrew. That makes things a lot easier for me and my family during treatment, but does this mean I get to leave?
Well, the pharmacist.
Hi Pat, I'm sure you're very excited to finally be heading home. However, before the hospital can discharge you, there are a few things you need to know about medications and further appointments.
Well, medication? The side effects of my current doses are already way too much. I don't know if I want any more.
That is a valid concern for you to have, Pat. However, I can assure you that myself and your doctor have worked really closely to ensure your medications react normally and are suited to your needs. You'll still need to take your leflunomide and prednisone for your arthritis, but we have also prescribed you dexamethasone, which you'll need to take during your radiation treatment to prevent any cerebral edema.
Okay, that doesn't seem like too much, but what happens if I run out?
Your GP and community pharmacist will take care of all your prescriptions when you're discharged, so you have no need to worry about that. Do you have any other questions?
No, I think you've explained everything. I believe I should be able to follow this plan. I would like to leave now to mourn the loss of my grandson with my family. Thank you for being clear with me.